Now, the head of the NHS in England says that hundreds of thousands of people could be suffering the effects of what is now known as long COVID. For most people, COVID-19 is a relatively mild illness which passes quickly. But many others are left struggling with symptoms for months afterwards. Some can be exhausted just with a short walk. Others can experience much more severe symptoms. Our medical editor, Fergus Walsh, has been investigating.
So initially I couldn't even climb a flight of stairs.
This is what long COVID can look like.
Okay, arms across your chest.
Suji Yatindra is a doctor in A&E. He got only a mild illness with COVID, yet it's left him so exhausted he's been off work for 3 months.
Short of breath quite easily, lots of muscle aches, joint pains. That's it really. If I do exercise, the next day I'm out of it.
Okay, so I'm going to time a minute and get...
This post-COVID clinic at London's University College Hospital is diagnosing a vast array of physical, mental and cognitive problems, all stemming from coronavirus infection.
So we're seeing people with really severe fatigue and really significant breathlessness. You know, people who were running marathons at the beginning of the year, previously fit and well, didn't need any hospital admission for their COVID, but 6 months on are too fatigued to even get to the shops to buy food.
Long COVID is a huge emerging health problem. Doctors say there's an urgent need for research into what drives the condition and produces such a wide variety of serious, debilitating symptoms. Many people are struggling to get help with the after effects of coronavirus. The boss of NHS England says £10 million will be spent on setting up more long COVID clinics across England.
It's clear that there are tens of thousands, probably hundreds of thousands of coronavirus patients with these long COVID symptoms. So we need specialist clinics like this, but also rehabilitation services across the community to both support those patients and to learn more about the best treatments for them.
Between 60 and 70.
Like so many with long COVID, Robert Moore had only a minor coronavirus infection. Yet the 30-year-old suffers repeated muscle and joint pain brought on by any physical activity.
As soon as I do anything, whether that's going for a walk or preparing something to eat or doing any form of cognitively difficult tasks, I'll just find a huge amount of fatigue the next day, whether that's muscular or just a sort of general fatigue.
So far, the focus has been on saving lives in the pandemic, but COVID is leaving a bitter legacy for many that may stay with them for months or even years. Fergus Walsh, BBC News.